India is reaching a grim milestone of nearly 500,000 COVID-19 infections. It has reported more than 17,000 new cases, logging its biggest single-day increase. This is the fifth time in 6 days that India has recorded an all-time high. The government is rushing to ramp up its healthcare system and increase testing. In the northeastern city of Guwahati, health authorities have imposed another lockdown after a surge in new cases. For more on this story, Neha Punia joins us from New Delhi. Neha, we're hearing another new daily record in COVID-19 infections. How are authorities responding or handling the situation?
Steve, the rate at which infections have been growing in the last few weeks, by the end of this weekend, India will have more than 500,000 cases. And after that tally, it will have added 100,000 cases in the span of just 1 week. But the government says it's not too alarmed by these numbers. It's saying that the reason why we're seeing such a big spike over the course of the last 1 week is because many states are now testing far many more people. For example, here in Delhi, which has the biggest caseload now in the entire country, having overtaken Mumbai this week. The testing has been ramped up to about 15,000 tests a day to from about 5,000 tests just 2 weeks ago. You've also mentioned Guwahati. That's another important instance to take into account. While the government says the spike in cases is nothing to be worried about, but state governments have for a while now been questioning whether the lockdown was lifted too soon, as the government has been feeling pressure to revamp and restart the economy. So the state of Assam, where Guwahati is, the government there saying that for the next 2 weeks, starting Sunday, there's going to be a complete lockdown in that city. So much so, it's going to be even stricter than the one we saw during the nationwide lockdown. For example, most people will not be allowed to step outside their homes to even buy essential commodities like groceries, with the state's chief minister saying that do all your shopping by this weekend.
So more restrictions perhaps anticipated for them. Neha, with all of these numbers soaring like this, how are people responding to the worsening outbreak?
The reaction has, frankly, been very mixed, Dawn. There are a lot of people who are wearing masks, who are limiting their mobility. They're not stepping outside their homes unless absolutely necessary. But there are, frankly, more people who are going out now, with the government allowing shops, restaurants, malls, religious places even to reopen. And the biggest challenge has been getting people to wear their masks and wear it properly. For example, Prime Minister Modi today, while addressing an employment event, said that in the absence of a vaccine, the only medicine against COVID-19 is to ensure you maintain safe distancing and follow government directives. And that's been the biggest challenge across the country. Many state authorities say that while people are stepping out now, many of them are not wearing their masks properly. Even when I go out, I see sometimes people have their masks around their necks. Sometimes they're wearing them on their heads. And even maintaining safe distancing has been a huge challenge. We've seen this in states like Tamil Nadu, as well as here in Delhi, with the government repeatedly saying that you can come out, but ensure you're maintaining proper distance. For example, when you're standing in a line outside a shop, or if you're going to a mall. And that change, authorities say, will take some time to sort of be imbibed by the general population. Many health experts are still saying, given these challenges, the biggest criticism has been that perhaps this lockdown was imposed too soon, when India only had 500 cases, and has been lifted too early when these cases are steadily rising by an alarming number.
Still plenty of challenges ahead for India in this fight. Neha, thank you very much for that. Neha Punia there with that update from New Delhi.